As the coronavirus pandemic paralyzes the lives of people, frontline health workers and doctors have been putting up with unpleasant events to treat the infected. A collaborative effort seems to be the key to alleviate their burden at this time. Right from dealing with the risk of pathogen exposure, working for long hours, and experiencing occupational distress, enduring physical violence, as well as social stigma, doctors and frontline health workers in the country are not breathing easy. Ever since the surge in coronavirus cases, the very people who are attempting to detect and treat the virus have been facing multiple challenges. India's PPE crisis puts workers in the line of fire. With a broken supply chain and inadequate stocks, healthcare workers face an acute shortage of protective gear and the risk of contracting coronavirus. Every day, 15,000 new cases are confirmed in India. With 5,29,000 active cases in India right now, there are over 17,000 deaths. While the Delhi government has claimed that about 2,000 people have died so far in the city from COVID-19, there have been 2,346 cremations and 981 burials that have been carried out in adherence with the protocol. When we are dealing with a deadly pandemic, it's important to know the truth. Correct numbers, reliable data are the only way we can get a firm grip on this crisis. The plights of healthcare workers in India can be summarized as follows. Most healthcare facilities in India are facing shortages of personal protective equipment or PPE, including face masks, gowns, and respirators. Either the hospitals do not have these available in adequate numbers or they cannot afford to purchase the PPEs. In these extraordinary times, the healthcare providers must adapt and be flexible so that they continue to safeguard themselves, their colleagues, their families, and their patients. As the virus spreads, the challenge for the healthcare workers and other members of their communities to keep themselves safe is increasing day by day. It is nearly impossible to tell who has been infected with COVID-19 until he or she is displaying the symptoms. At this point of time, healthcare workers really need these equipments, which are in extremely short supplies. There are reports that doctors have been using substandard PPEs, which some have compared to raincoats, akin to sending soldiers into war with misfiring guns. If we are to win this battle against coronavirus, the country needs to support and provide resources for its doctors and other healthcare workers, just as it would support its soldiers in a war. So, to make that happen, I stand against Corona.
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 I stand against Corona.